Hello, everyone. I want to welcome you to today's Immigration Rights Workshop. My name is Benga Gunjimi. I'm the founder and executive director of the Nigerian Center. You are welcome to this event. The title of this workshop is Immigrants and Access to Healthcare. So before we get started and introduce our main speakers for today, they'll be talking about the barriers that immigrants might face in accessing healthcare in the United States due to their immigration status. And the main speaker we have is Dr. Ebere Azumah. She is the president of the Association of Nigerian Physicians in Americas, the Washington, D.C. chapter. She'll be joined by Nigerian Center immigration attorney, Melvin Jarrett. And together they'll be talking about putting a spotlight on this issue and talking about resources folks can avail themselves. But before we do that, what I want to do for those who are meeting Nigerian Center for the first time is to talk a little bit about the organization. Nigerian Center is the very first Nigerian American Cultural and Immigrant Center in the United States. We are located in Washington, D.C. While we are called Nigerian Center, we do serve all immigrant groups across the country, regardless of the country they come from. We've identified a few areas of asset building for the work that we do. The chief among them being immigration, as is very critical for our community. We know that without immigration, rights and access, it is impossible to access any resources. It is impossible to start a conversation around financial inclusion. It is impossible to be able to, in this case, there are barriers that may exist in accessing healthcare. So to do that, we hold this monthly Know Your Right immigration workshops. We also have a walk-in clinic in Washington, D.C., as well as a national virtual program where folks can access legal resources. We do have home ownership programs. We do home ownership education and counseling. Tomorrow, we're going to have an immigration workshops as well. You can feel free to participate in that. We have a lending program that provides access to capital to folks from $500 to $250,000. Some of these loans are without collateral, without credit decision. And as we know that for a lot of immigrants, particularly those who come from countries like Nigeria, that may not have a credit system, it takes a while to adjust the American credit system. So we kick in and we come in by providing credit building loans for anyone that comes into the country and those who are ready to get their business started. We have a language class in Hausa, Igbo, Yoruba. We are about to start enrollment for our spring 2023 programs. The announcements will be coming soon. Lastly, another thing we do is we have cultural programs. Our cultural programs is an opportunity to educate and to promote the Nigerian culture in the United States. This involves live plays, workshops, seminars around Nigerian culture. So if you follow us on social media or on our newsletter, you'll be getting announcements of these events as they come. So the next I want to quickly talk about is opportunities to get involved in the programs that we do. As I mentioned, we do have a walk-in clinic in Washington, D.C. That is absolutely free at no cost to you. And this clinic holds every Thursdays, 12:30 to 4:30 p.m. Those who are not in the DMV area are still able to get access to immigration counseling and help. There is a small fee of $50 associated with that you're going to make on the website, but you will have access to the same resources virtually. All the recording of our workshops, including this one, are available on our media page on our website. I encourage you to please visit the media page Relating to immigration, we've done a treatment on family-based immigration, employment-based immigration, humanitarian-based immigration, and sometimes recent policy changes to immigration. All of these videos could be accessed on our website on the media, nigeriancenter.org or the media. In about 24 to 48 hours, this particular workshop will be available online as well. Volunteer opportunities. We are constantly accepting applications for those who want to, in any capacity, join our team and volunteer. Nigerian Center is a predominantly volunteer-led team, so we welcome volunteer applications. We have started our community partners programs, and there's an opportunity to connect with grassroots organizations. It's more of a listening session where you tell us areas of pain points in your communities and how you can be a conduit for us to reach those we may not be able to reach in our office or with our programs. So if you go to Nigerian Center Community Partners, you're able to sign up. We are calling on grassroots organizations, media, business, for-profit, faith-based, cultural organizations, student groups, any form of platform that have access to immigrants, particularly Nigerian, African immigrants that think our programs may benefit their community. We welcome you to be our community partners. If you're not following us, please go ahead and follow us on Facebook, Twitter, and Instagram, the Nigerian Center. Some of the platform we are just Nigerian Center. Some of them is the Nigerian Center. We recently opened LinkedIn as well, so please join us on LinkedIn as well. Yes, so donations, we do welcome your donation. Yesterday was Giving Tuesday. I might have called a lot of you, and someone of our team, might call a lot of you to reach out to support us for Giving Tuesday. Giving Tuesday is not just a day. The Tuesday yesterday symbolizes giving, so you're still able to participate in Giving Tuesday. Please visit nigeriancenter.org/donate to make a contribution. I want to highlight that most of the time, when folks hear donate, they immediately discount themselves out of the conversation because they might not be in a financial position to do so. We understand that, and donation could be literally $1 to be a part of it. And we really want you to be a part of our donor community because it is contributions from people like you, yourselves, that keeps our door open. Okay, that said, I'm so excited to bring to the platform Dr. Ebere Azumah as our guest speaker today. As I mentioned, she is the president of Washington, D.C. Chapter, Association of Nigerian Physicians in the Americas, and she'll be speaking on the topic, Immigrants and Access to Healthcare. You are welcome, Dr. Ebere. I'm going to turn it over to you.
Hi, thank you so much, Benga, for allowing me to be here. Let me quickly share my screen. And we can go from there. Thank you so much. Welcome everybody to Nigerian Center. Bear with me as I share my screen so that I can get started. Pardon me, let's go to this. All right, so I hope everyone is doing well. Guess what? Today is the last day in November 2022. This year flew by so quickly. But for most of us, I hope we had a great time. Thank you, Benga, for the introduction. And Benga, I congratulate you for being the visionary of the Nigerian Center. We also want to honor our attorney, Melvin, that is here as well, and everyone they here. I am very excited to be speaking on such important topic. Immigration's right workshop, especially immigrants and access to healthcare. So before I get started, let's go to my slides. All right, so today I'm going to break down this conversation into parts. Thank you to Benga for walking me through and making sure I'm ready for this. Benga is so amazing. God bless him and his wife as well. I give her respect. So I'm going to talk about me, and then I will talk about my journey and then becoming a physician. So let me quickly talk about myself. I do know Benga mentioned, talked about me a little bit, but I will reiterate. Again, I'm a board certified OBGYN. I'm a public health professional. I went to Harvard for my public health training. I went after I became a physician. I'm a community health educator, and I'm also an author. But I'm here today as the chair, not yet the president. I'm not the president of AMPA, but I'm the chair of the Association of Nigerian Physicians in the America, the DC, Maryland, and Virginia chapter. So AMPA, DC, Maryland, and Virginia chapter. I give honor to Dr. Chinyere, who is our president of the entire organization. I'll talk about the organization shortly, but the organization has about 4,000 physicians in the United States, physicians and dentists as well in the United States that care about Nigeria, Africans, everybody basically. The vision of AMPA is a healthier Nigeria, a healthier Nigeria in a healthier world. And we take it seriously. We believe like if we keep Nigeria healthy, we'll keep a large percentage of Africans healthy, but we welcome everyone as well. I'm also the founder of Healthy and Uplifted. It's a nonprofit organization that I founded. You can see some of our educational webinar on YouTube. So we just talk about things about motherhood and what mothers go through, because it's not easy being a mother and a professional, or just being a mother and a housewife. So sometimes we need that support. I'm also the founder of Azumah Solutions, which is like a consulting, coaching company whereby I help other people grow and start things. So that's one of the companies. And I also I'm the founder of Elevating Her Mind. It's just a mindset support group that just helps people, because I believe if your mind is enlarged, you see the endless opportunities around you. I'm also the co-founder and president of Love Your Menses, Inc. It's a global organization that works to educate women, girls, dads on menstrual equity. So we go to different countries and provide sanitary towel, education for the people. So it's really an amazing organization that I co-founded in 2019. This a few months ago, in October, I was in Kenya doing a workshop for our community educators in Kenya about menstrual equity, and just teaching them how to go to their community and empower young girls. During that event, one of the young girls looked at us and was like, "You guys are my role model. I'm so happy you're talking about menstruation in Kenya. We don't really talk about it. It's like taboo." And to us, it's not a taboo. It's part of being a woman, being a girl. So it's really cool to be able to decrease or reduce stereotype through education. Apart from that, I'm a trained doula, so I love it because it allows me to think differently as a physician that provides care to women, especially pregnant women. I'm a certified life coach. I do organizational consulting. I blog, I speak, and I've written books. I even co-wrote a book on immigration, sharing my story as an immigrant. Like Benga would tell you, we believe that everyone has a story. In everyone's story, there's a lesson to be learned. And that's why I love our Nigerian or African culture, whereby we tell stories. So we use stories to instill moral lessons. We can even go deeper and say the Bible also did that when Jesus talked in parables. So me and Benga, we have something in common, is we like sharing stories. All right, so I've talked about myself. So I'm going to quickly talk about my journey. My immigrant book has it. If you guys don't mind, I co-wrote it with a bunch of female professionals that are immigrants. It's called the Warrior Women Project. It just talks about our stories. It's really beautiful. If you want to get it, it's on Amazon. If you want me to get you a copy, just send me a message, and then I might give the first few people that reach out to me. So my journey. I still remember when we got that phone call that we are coming to the United States. I was in just Nigeria, even though I'm Igbo in terms of heritage, I was born and I grew up in the north in Plateau State. I went to a school called St. Louis College. So right there, I remember my brother, my older brother, telling me that we finally got a visa to come to the United States. We come to the United States. Luckily for us, our story was different from others. We came here with our green card. So it was different. So we came here, we had fun, but let me fast forward. There was one time, because my mom did menial jobs, so we didn't have health insurance. Like, I guess I'm aging myself. We didn't have health insurance. So there were periods where I did not have health insurance. I didn't. So I would utilize the university. I went to University of Michigan, those in Michigan. University of Michigan had a health center, like health service that I would go to get care. But then during the holidays, I would not have any insurance. That's before like the Obamacare and whatnot. So I had periods where I didn't have insurance. So I had my own story. So that was when I was a youth. Then let me fast forward a little bit with my insurance story as well. In 2014, I had finished residency and I was going to start working. I was moving to DC, yay, to work at Providence Hospital under our chair, Dr. Majambi Maya. So there was a transition before I started working. We had to get licenses. You know, it's a process, especially if you don't have a mentor, keyword mentor. So I didn't know to start applying early. So it was taking a while. So there was a delay. I couldn't afford to pay for my own insurance at that time. Thanks to HIPAA, we'll talk about HIPAA shortly. Thanks to HIPAA, there was a COBRA coverage, but the COBRA coverage was too expensive. I mean, I didn't come from a wealthy family. Like, who's going to give me $600 per month to pay for COBRA? So I decided, I'm not going to have any health insurance. I'm just going to rig it like I did when I was in college. No insurance. But guess what? Benga, I don't think I told you the story. I got into a car accident. A drunk driver hit the car. So I was burnt like my entire body and I didn't have health insurance. After I stayed in the ICU for about 2 weeks, I was discharged home. When I was home, I wasn't there like thanking the Lord, like, oh Lord, thank God for my life. I was sitting down saying, how am I going to pay my bill? I already have like my student loan for medical school. I'll talk about my medical school journey or my journey into becoming a physician. But now I have $500,000 of debt from health insurance, like from my health care. I was nervous. I was scared. I was like, is it going to be bankruptcy? How am I going to pay this amount of money? It's different when you borrow money to invest into a business, but it's another if you owe a hospital this amount of money. Anyhow, to make the matters short, I was fortunate that I didn't have to pay back the $550,000 for my health. And I'll tell you the story. What happened was my colleagues, my friends, one nurse in particular, Emily, she was able to raise some money for me. And I was able to go pay the COBRA. I had 1 day for the COBRA window to expire when I paid for it. So I was able to activate the COBRA and the COBRA went back and paid off that loan. That's how I don't have that debt. So I do understand lack of health access. Definitely I was for Obamacare because one, my personal experience, two, the experiences of those around me. So I just wanted to touch base with you all that I understand, you know, sometimes when we are physicians, some people forget that we're humans too, or some people just do, but we really are humans and most of us also have a story. And that story will always be with me. And patients that know me, that I take care of, will say one of my superpower is empathy. I feel it. And they don't know my story because they just don't know. They didn't know that this one time I was going to food banks. Thank God for food banks to get food because I didn't have that, you know, and that's okay. We can have whatever story we have. The most important thing is we should always strive to improve upon our past. And that's why Nigerian Center is here, Benga's vision, to help people move past where they are by God's grace, I will never go to a food bank, but I will always support one. So the next story is becoming a physician. So when I came to the United States, my mom had health conditions, and she didn't have that much money. She was at the time a single mom with like 5 kids. So, but I had skill set. I had my scar from my fire accident from the drunk driving 2014. Anyhow, so I would work as a hairstylist. Like I knew how to use my hand a lot. So I would braid hair and then I'll give her the money because I didn't know anything about money, even though I wish I knew more because I could have invested some of that money and be wealthier. Anyhow, I would give it to my mom to take care of herself. So I really wanted to become a physician so that I can help people like my mother. After I went to the University of Michigan, I then went to Wayne State School of Medicine in Detroit. Love that school, love it so much. And then after medical school, I decided to go to residency. At that time, I wasn't sure if I wanted to do family medicine with a focus on women's health, or if I wanted to go ahead and become an obstetrician. I ended up becoming an obstetrician. So I went and learned about obstetrics and gynecology, more about women's health, which I love. And then I finished residency and then I began to work. But when I was working at Providence Hospital, I don't know if you guys remember it, they closed down. They closed down, I believe, in 2017. So I worked there from 2014 to 2017 under the leadership of Dr. Majabi Maya. I loved it. I had good mentors. I had good support. We took care of mostly immigrant women that were very appreciative of our services. So there were so many reasons why the hospital closed down, but it was a shocker to me because at the time when I was in medical school, we just learned about providing care. I didn't realize that there was more to providing care. Hospitals need the money to stay afloat, right? They have to pay their vendors, they have to pay for instruments, they have to pay their staff. So if they're not generating money, they could shut down. So it was a shock. I thought I was going to retire from Providence because I loved everybody. I even bought a home next door. I just loved everybody. It was like family. I've never worked where everybody like looked like me, cared like me. It was just beautiful. I was like, oh, I'm going to retire here. But things change. And that's one thing we have in common with life. Things change. Change is inevitable. So during that process, I decided, okay, I'm going to go find out the business about medicine. So I applied to Harvard, to the Harvard T.H. Chan School of Public Health. I got in, I moved from Maryland, where I was located, to Boston to go and study. So I went and I learned about public health and I loved it. I loved public health because I realized that population health was my interest as well, keeping the community healthy. So after Harvard, I worked and then I'm back in the DC area, continuing to do community health. So that's my brief journey of becoming a physician, a public health professional, developing passion for the underinsured or uninsured, because I'm there, I've been there. So that's briefly about me. So now let's move to the next item. So what are some challenges we have as immigrants in terms of accessing healthcare? False information. We have so much false information out there about access to care. Some people are like, so I work in a facility and we take care of undocumented immigrants, and they come in late to get their prenatal care all the time. And I'm like, wait a minute, you're like 30 weeks into your pregnancy. You have like 10 weeks left. What happened? I didn't think it was necessary in my home country. I didn't get healthcare. Like I just was ready to push and I pushed, you know. So some of them don't think it's necessary. Some of them feel like if they go to get care, they will be deported because people would know that they are undocumented. And it's hurting everybody because when they come, we do our best to take care of them, but they've missed some vital screening, testing, communication, relationship development between their physician and themselves. So we say, how can we help you? How can we help you know that you have access to care, regardless of your immigration status? We are not allowed to ask about immigration status. So false information, you're not going to be deported or reported because of your immigration status. Most physicians, midwives, nurse practitioners, providers of health don't care. Like, we're here to like serve you. Again, the second one is fear of being caught. Like, immigration is not going to catch you by going to the doctors. It's not true. It's not true. So don't be scared. The third one is not trusting the medical facility. Again, it stems from fear. We do not report anybody. Like, we are there to serve you. Tell us the truth. Tell us the truth. We can help you when you tell us the truth, because you not telling us the truth can hurt you because we might not have enough information. All right. Some cultural practices that have to go. I would piggyback on what I said earlier. You need to get prenatal care. I do understand that in some of your country, you guys need prenatal care. Here, we recommend it because we can easily diagnose things earlier, especially if you're a woman that wants to get pregnant. Please get preconception counseling or care so that we can see what is going on in your body. For example, if you have diabetes, you don't want to wait until after you've gotten pregnant for us to optimize your care, because we can screen you using your hemoglobin A1C and say, oh, your hemoglobin A1C is 8 point something. Why don't we work together with your primary care physician and lower that hemoglobin A1C to a part that it will not be detrimental to the development of the child? Because some people will have very recurrent miscarriages because their diabetic level, their insulin level, their sugar level is really, really high. Again, sugar level is really, really high. Or if you have high blood pressure, you want to optimize it. You don't want to have it in a stroke-like range. You don't want to be pregnant at like 20, 22 weeks, 23 weeks, and they have to admit you to control you from situations like high blood pressure. Now it's your life versus the child's life. So it's important to just get preconceptional care, because that would help save you a lot of problems. Or if you have kidney, renal disease, it's best to get, evaluated so that you can see if you're even a candidate for carrying a child, candidate to have a child. It's also very important for us to get preventative care. Go in, do that pap smear, see if you're at risk for cervical cancer. We can help prevent it before it gets worse. Same thing, go get your dental care, go clean your teeth, so that you can optimize everything. It's pretty important. Thirdly, it's very important for your family to understand their family history. Like a lot of we Nigerians, we Africans, we don't really know our family history. We don't know the genetics. We don't know if there's anybody in our family that has autism, that have Asperger's, that have ADHD. We don't even know if people in our family have sickle cell traits. We don't even know in their family if they have asthma. We don't even know if they have cancer. Like, they're like, we don't talk about it. So it's very important that we know so that we can know how to prepare you. For example, if your mother had, let's say, breast cancer, ovarian cancer young, it would prompt us to treat you and evaluate you differently, to monitor you, to even start screening you for breast cancer. So there are things that can be avoided if we don't keep secrets, like from our kids, about our health. The other thing is faith versus health. I'm a person of faith. I believe in God. I love the Lord so much. But it's important to also go get evaluated. You going to healthcare doesn't mean that you don't have faith. we have to remember that a lot of us in the healthcare field are people that serve the Lord. I mean, my friends serve the Lord and they're physicians. So remember that if it's a negative thing, we would not be in it. So remember that. And in the end, as a believer of Christ, God is the one that gave us all knowledge. So all knowledge comes from him. And I feel if you refuse to go to get health care, you're basically refusing to accept the gift that the Lord has given to us. As we see in the Bible, that sometimes the Lord will say, go bathe there to get healed, put a clay on the eyes of someone for them to get healed. So is physicians and the work we do. And the truth is, we can do all of this. And if it's your time to go, you will go, right? So consider going to get healthcare, not letting your faith stop you. Just see it as a gift from God as well. All right, so we're going to quickly talk about the rights of our patients. I think I alluded to it. I talked about the HIPAA law. The HIPAA law was initiated by President Clinton, I believe in 1996. Initially, the law was to help ensure that workers have insurance between jobs, like the COBRA, but it has expanded, and it's now a Bill of Rights in my summary for patients. So basically, the HIPAA encourages or even forces physicians and auxiliary staff, hospitals to respect patients. So you have every right as a patient to be treated with respect. I saw someone recently that was talking about how she asked her obstetrician, like how obstetrician was going to recommend a contraceptive for her birth control pills. And she was asking questions about side effects. And the physician was like, you're asking me too many questions, like just take it. And because of that, she left the practice. And to be transparent, the patient needs to consent to treatment. And that's one of the HIPAA laws, that rights that you have, excuse me, that's one of the HIPAA rights that you have, the right to consent. So yes, you have, and consenting means that all your questions need to be addressed. This is America, like they should address everything. I'm not suggesting that you go to your doctor's rude, because I've seen extremes in patients. There are people that are extremely timid, that cannot look a physician in the eyes to ask questions. And then there are those that are like very boisterous and aggressive, and like, you're like, chill, I'm not your enemy right here. I'm an immigrant. I have my immigrant story as you. I'm Black as you. You don't need to do all of that energy. I am not here to hurt you. And sometimes I would nudge the patient and say, are you okay? What's going on? I mean, we're in this together. You're not by yourself. And then most times it calms them down. So the HIPAA law basically tells you that you have the right to be treated with respect. You have the right to obtain your medical records. So that patient that was going to switch out from another practice has the right to go and get her records. The physicians also have a right to charge you for printing out things. But now most of us have our medical records on file, so you can also get that records for free. Most facilities gives you that opportunity. You have the right to privacy. So a physician cannot divulge your medical information to your family members. And again, let me talk about that. This is an important part, because most Africans will bring their relative and want us to tell their relative information about them. And we say, no, the patient has to give us that permission to do so. We cannot just divulge it. And the man will be like, but I'm her husband. What are you talking about? I'm her husband. I pay the insurance, Yes, I get it. But the HIPAA does not allow us to divulge information without the woman present. So it's important, like, you give us that permission to do that. The other thing that I've noticed in healthcare access is the woman not wanting to make decisions. She would look at her husband, honey, should I get an epidural? Epidural is the original anesthesia that we give to women when they're in labor. Sometimes I see African women that are really in a lot of pain, but they're looking at their spouse, which is okay to respect your spouse. Like, honey, should I get that epidural? Please, I want it. We listen to the mother and not just the husband. We listen to the mother first, the woman, the patient first, and then if she gives us permission, we pull in the family. I know this is different, but this is what we do. You as a patient have the right to make treatment choices. You can make choices. This one also says you have the right to refuse treatment. We've seen that. We've seen people with Jehovah's Witness background that would refuse to get blood transfusion, even when they have no blood in their system. This HIPAA law allows you to make that decision. You as a patient also have the right for end of life care. You can decide you're not going to eat. You can decide what you want to do. All right. Another rights that I think every patient should know is the EMTALA law. It's an Emergency Medical Treatment and Labor Act. It was enacted in 1986 that basically says nobody will be denied access to emergency service regardless of their ability to pay. I've heard stories of women immigrant undocumented women going to labor and delivery, going to receive care, and they'll turn them away because they don't have insurance. And when they come to me, we call whatever facility that is, and we say, no, you can't do that. EMTALA law says they have to be evaluated. So I want people listening to know that regardless of your ability to pay, regardless of your documentation, you have the right to be treated with respect. So if any physician is not treating you with respect, you can remind them that HIPAA law allows you to be treated with respect. And if they're not listening, you can escalate it to their supervisor and go from there. Again, I'm not saying not to be reasonable, because we've seen some patients that will escalate things, that will make up lies just because the patient will not the physician will not bulge in or will not accept something they want us to do. For example, oh, I don't want to work again. Can you send me a letter saying that I shouldn't be working? No, we would not take you off of work except it's clinically indicated. Because we sometimes say no to it, patients get mad and want to report us. So it has to be reasonable, because we cannot also create perjury because we're trying to please patients or because we're trying to respect patients. Our license will also our credibility as physicians will also be questioned. All right, and resources that are available. If you're documented and your company provides you with private insurance, then sign up for it. Private insurance could cost you money, right? Most employers will pay some amount and you will pay the difference. And you might be, when you go to see a doctor, that you might be asked to pay a copay. So that's an option. Then there are other options. There's the Medicaid. For those that are documented, but meet a certain financial criteria. Melvin can touch more on that. And then we have the marketplace, thanks to Obamacare, which is coming up now, where people can sign up and decide which coverage they want. And then for those people like me, like I alluded to in the beginning, that had no insurance or are undocumented, they can utilize their student health programs, which is basically paid under their tuition. We also have concierge medicine. So now a group of physicians are saying, no, I don't want, a third payer. We don't want the insurance company dealing directly with patients and us, like patients, insurance company, and then physicians. So some people are going directly to the patient, or the patients are coming directly to the physician to negotiate a deal whereby they can see you for a certain amount of monthly subscription. So I don't know if people know that, but that's an another option. So there are many providers that provide that. So if that's one thing you're considering, let us know. And then we have community health centers that does not ask you about, your status, your immigration status, or your ability to pay. I have worked in a community health center. I've worked in Unity Health Center for a couple of years. And there we treated everybody. We gave people quality care without asking them about the ability to pay. So briefly, that's about it. So now we are ready for Q&A. I call it Let Us Chat. But before that, I want to leave you to ponder on this. I love writing quotes. I blog as well. I always tell people, when you have life, health, and a sound mind, always remember you have endless opportunities, because there's so much opportunity around us. Thank you so much. I appreciate it. I'm here to answer your questions. Thank you. Benga, Melvin.
Thank you so much, Dr. Berry. My first question is, how would you respond to those who might find it strange or foreign? You go to an hospital, you have an insurance, you don't have an insurance, they say this is your copay, and the bills never stop coming. And weeks after, something comes in the mail. But I thought we took care of this. So can you just speak about that so folks might be aware that is a possibility, and what usually happens at the back end where all these bills keep coming when they already gave you a bill and you thought it's taken care of?
Excellent question. I like that. Recently, I want to say a year or two, Congress decided to put a bill that ends secret bills, because that's just so annoying. So I think most hospitals are cutting down on like sending you unnecessary bills over and over again. However, if that's, oh, this looks twisted. Sorry, guys. Okay. Oh, I think it's my thing. Sorry about it's beveled. Sorry about that. If that happens, just call the hospital and then they will fix it. I'll give you an example. Mine wasn't like continuous bills, but what happened was I took my daughter to go to her doctor. I think I called you that day, Benga. I took my daughter to get preventative care, just a pediatric wellness check. And later on, we got a bill for, is it $500 or $600? And I'm like, wait a minute, I'm a public health person, I'm a physician. That makes no sense. Preventative care should be free. So I called the insurance. So that's the first thing I did. I called the insurance and I said, what's going on? Why am I paying $500? Like, this doesn't make sense. So they were able to explain to me that the pediatrician that I was seeing was out of network. And so that was why. And I was like, wait a minute, how is this out of network? I've been with this physician for as long as my daughter was born. So I guess someone realized it, and then they decided to send me a bill. I don't know what happened. So I went to the facility and I went and I talked to the manager and I said, I've been coming to this practice for 6 years. You guys never told me that you guys were out of network, because it's supposed to be their job to let you know that they're out of network. And you guys are giving me this $500 bill. Like, this is not cool. I was able to talk to her and they waived it. So my question is, call, ask, don't just pay. I'm sure I have the ability to pay, but this could be an error. So look it over, call them, be polite. Be polite. I think that's key. The key is to be polite. Because if you're polite, you know how they say that you can get more bees with honey? Like, it really, really works. When you're polite and calm, someone is going to help you versus when you're belligerent and angry. So that's what you do. Call them, speak to them, make sure that it's not a mistake. And if it's a mistake, they will catch it. So that's one thing that you could do. To their charities that are out there that can help you, like the Catholic charity, even the hospital charity can also help you. The hospital has a foundation. Most hospitals have a foundation. So if you speak to the foundation person, they can help you. You can also speak to a case manager, a social worker. There's just someone that can help you, especially if it's financially turbulent for you to pay that amount of money. do not let it stress you. You can call Benga, you can call anybody, we will direct you. But don't be rude about it, and don't seem like it's our right to help you, because I've seen people do that as well. Like when you try to help, they feel like it's their right, and then they become rude, not realizing that most of us that do this work, we do it out of the generosity of our heart. Benga, does this answer you?
Yes, it does. Thank you so much. Do we have any other questions for Dr. Ebere?
Can the attorney Melvin chime in, like if he wants to add to that?
Oh, so
Yeah.
Marvin will be coming to kind of close us out,
Okay.
to give us the legal aspects of that, but he may have certain questions for you. But before we bring Marvin on, I just want to quickly tell my story regarding community health centers. There are also nonprofits that have a medical program. One day we're going to get there at the Nigerian Center. When I was adjusting my status, I didn't have the opportunity like Dr. Berry that came from overseas with a green card. So we had to fast and pray to change the visa to a green card. So when I was going through that journey, and finally I got the advisory to provide my medical to do some tests and medical records and things like that. And some of the tests I needed to do, I didn't have insurance at that particular time. Some of them, I couldn't even do them without having an insurance, like over the counter. So I couldn't even go to CVS and get some of those things that was required. So I was like, what am I going to do? And I think was one of the calls I was directed to a nonprofit in DC called SOM. And it's an acronym, so artists might eat. They have a homeless shelter. They also have a medical program, and it's available to anyone regardless of immigration status. So in your city, you want to look at nonprofits with health programs, community health programs. And I called them and I told them my situation, and they told me to come in the next day and they do all the tests for me with $0 paid. And that was how I was able to turn in to the immigrations. So that definitely exists. The resources Dr. Berry gave is real. I'm a beneficiary of that. So look into your states and see from the nonprofits, and in addition to the other resources she mentioned. So at this point, I'm going to turn it over to you, Attorney Melvin.
Thank you, Benga. Thank you, Dr. Azumah. That was
Yes,
very good information. Um, very grateful to have you on board today. For the most part, if people have a status, there's some access to healthcare, whether or not you are a student or, like Benga said, you can find an organization, a nonprofit that can provide some access to healthcare. The national HIPAA and laws and things like that can be a barrier sometimes, but through the things like the EMTALA and the Patient's Bill of Rights, if you need life-saving treatment, you can pretty much go anywhere and you should be able to get health care. If you feel like your rights are violated, you can seek out an attorney. What I want to speak about today are the people that are undocumented who can't find health care, and speak on that locally, since Benga brought up his situation. Everybody should know by this point that DC is a sanctuary city. And you can check out a couple of websites, the National Immigration Forum and DC Action. And these talk about a couple of programs that were created right here in DC, the Immigrant Children's Program and the DC Healthcare Alliance. And these are similar programs, but they're available to people without a status. They give you some of the same coverages as Medicaid. Some of the differences, the Immigrant Children's Program covers vision, while the DC Healthcare Alliance Program does not cover vision. So you have an prenatal care. The Immigrant Children's Program does not cover that, while the DC Healthcare Alliance does. So you have a few differences there. But the important point is that this is available to non-immigrants. For the immigrant children's program, you have to be, I believe, 20 years or younger and not eligible for Medicaid and fall below 200% of the poverty line. And similarly for the healthcare, the DC Healthcare Alliance program, you have to be 21 or older. And again, not eligible for Medicaid or Medicare, and also fall behind the poverty line. So these are some programs that are available right here in the DC area. So people that don't have an immigration status, who can't go out and, let's say, purchase private healthcare. Well, you can actually purchase private healthcare, but it would be very expensive. But right. So, but if there are any questions, I think our time is running here. We still have a few minutes, but if there are any questions, I can take any questions right now.
Do we have any questions for any of our speakers? I see Ade online. Feel free to unmute yourself if you have any questions.
Now, I want to point out something that Dr. Azumah touched on earlier, some of the barriers that lie in the way of healthcare, and some of the myths that also lie in the way of healthcare is that undocumented immigrants receive a large fraction and a burden on the healthcare system. And Dr. Azumah, you can either back me up or let me know if I'm wrong on that, but that is absolutely not true. I believe around 2016, undocumented immigrants represented about less than 0.2% of the entire Medicaid expenditures. And similarly in the years to follow and the years before that. So that's one of the biggest myths that, you would hear perpetrated a lot in the community, that, the undocumented immigrants are a burden on the healthcare system. Have you heard that before? Go ahead.
Yeah, I have. Well, it's a different kind of thing. It's just undocumented immigrants, like I say, they wait till the very last minute to get care. So things that we could have prevented is like now we're treating. You know how like prevention is always better than cure? For example, let's say the woman has fibroids. Let's say fibroids, let's equate it to like the size of the uterus, right? Some immigrant women, because of undocumentation, will wait until like their uterus is like 30 weeks sized uterus versus 10-week size or 12-week size. So this surgery becomes more difficult and more expensive, because now instead of us having a laparoscopic surgery, like making little holes on the woman's belly, we are now, let me just make a, okay. So and this is the belly button. I don't know if you guys can see it. So instead of us having like maybe small holes, incision to do the hysterectomy or to do the myomectomy, hysterectomy is removal of the uterus. Now, this is the belly button. Now we are doing like a huge incision to like take out the, like open surgery to take out the uterus out. So the surgery becomes more cumbersome, more expensive, because now they might need blood transfusion. So it's not that undocumented are consuming the large amount of like Medicaid's expenditure. It's just waiting the last minute to do things is more burdensome and more tasking for the system. I would say that's where it comes from. Again, I don't justify it, but it's just a little bit more hard and more frustrating for people. But again, we are called to do it, so it's okay. Does that make sense, Attorney Melvin?
Absolutely, that makes perfect sense. So regardless, go get the treatment, the preventative care,
Yes.
And you still would not be a burden on the healthcare system regardless. So makes perfect sense. Thank you.
Yes, sir.
So thank you both for the insightful presentations. So a few things I want to do before I close us out is we're required to take evaluations for these workshops. I'm going to put the evaluation link in the chat box if you can complete that right away. For those who are catching this on the replay, if you registered for this webinar, you are going to receive the evaluation link in the email. We really ask that you take 1 minute to complete the evaluation form. And while you are completing the form, we particularly want you to give us suggestions in terms of next workshop topics that really specifically affect you or your community or people you know that we should also cover related to immigration. Let us know a topic suggestion you want us to consider or cover in our subsequent workshops. That'll be very helpful. I also want to mention again that we are still in the week and the month of Giving Tuesday, and Nigerian Center can really use donations from you. Please go to nigeriancenter.org/donate. Your donation of your financial donation of any amount is going to go a long way. We do have an immigration clinic in Washington, D.C. Please tell people in the DMV area it's free to walk in. There is no appointment required. You are able to schedule an appointment, but it's not required. There is no financial obligation or requirement for the service. It's a free walk-in. If you're not located in the DC area and you're not able to come in person, complete a form, an inquiry, an intake form on our website. There's a small fee of $50 to that. You would also be seen and be attended to with one of our lawyers. You should let people know about this service as well. Please check out our on-demand channel for all the previous recordings of our videos of all these workshops, particularly related to immigration, including this particular one that we are covering today. Consider to volunteer at Nigerian Center in any capacity, but at the very least, everyone should self-nominate to be an ambassador for Nigerian Center to let your community know that you have these opportunities. We have the Community Partners Program. This is open to leaders of community leaders, whether they are faith-based, community-based, cultural, student groups, media, business, medical, in any capacity that you have access to the communities we serve. The immigrant community is a listening session. We really want you to bring the pinpoint of your community to us, and we can incorporate that in our programming. The link to sign up is Nigerian Center/community partners. Join us on social media if you have not done so, and please complete the evaluation form. That said, I'm going to release every single one of us into greatness, and I want to thank Dr. Azumah and Attorney Jarrett for the expertise today, and I wish you a fabulous week ahead. Bye, everyone, for now.
Thank you.
All right, good evening.